In this video, we'll learn about Alport syndrome. It's a genetic disorder which affects the kidneys, ears, and eyes, and it occurs because of mutation in the genes coding for collagen type 4 collagen. Remember, type 4 collagen is a crucial component in the basement membrane of these organs, like in the glomerular basement membrane and in the cochlear, the membranes, in the stria vascularis, in the lens, no, the capsule of the lens. All these are made up of type 4 collagen. So when there's defect in this production of type 4 collagen, we get what is called as Alport syndrome. So if you can observe here, the collagen genes most commonly affected are collagen 4A3, A4 and A5 gene, and almost 80% of the cases is because of defect in collagen 4A5 gene is what is commonly affected. We'll just remember the common features which we see in Alport syndrome using a mnemonic here. The mnemonic here is collagen 4. Here collagen 4, meaning when I'm telling Alport syndrome, always you'll hear collagen 4, okay? Here meaning head stands for hearing loss, and this patient has a sensory neural hearing loss, and they'll also have eye defects, that is anterior lenticonus and flexi. I told you the capsule of your lens is mainly made up of collagen 4. If there's a defect in that, the anterior capsule loosens, and that will lead to cone like bulging of the anterior lens. And they'll also have flex is nothing but like perimacular flex, or like these are the small spots which are seen around the macula. And anterior lenticonus is a pathognomonic feature of Alport syndrome. And they'll also have abnormal kidney because the collagen 4 is also present in the basement membrane of this, in the glomerular basement membrane. So it will present as a nephropathy. Initially, they'll have a microscopic hematuria which progresses to proteinuria. And finally, they'll have end stage renal disorder. When we do a renal biopsy, remember the glomerular basement membrane will have what is called laminated appearance or a layered appearance, which will give a basket weave like appearance. So the collagen which is affected here is type 4 collagen gene mutation, who is what is the cause for Alport syndrome. So you can see in this diagram here, the anterior, this is a slit lamp diagram. If you see the anterior part of the lenses in the eye is, it is formed like a cone-like structure. So that is what is called anterior lenticonus. Remember A4A, okay? Anterior lenticonus is a pathognomonic of Alport syndrome. And if you observe the renal biopsy structure, this diagram here shows a normal glomerular basement membrane. You can see it is a well compacted glomerular basement membrane. Now your collagen 4, no, it acts like a mesh or a scaffolding over which other proteins will come and help in forming basement membrane. When the mesh or the scaffolding itself is defective, as happens in Alport syndrome, the thickness or the compactness of the glomerular basement membrane, or for that matter, the basement membrane as a whole, will be affected. So in the lower down diagram, you can observe we don't have that well-formed glomerular basement membrane, right? The compactness is not there. So it is like a weak structure, laminated, meaning like many layered structure it has formed, and it gives like a basket like appearance. That's why we have this basket weave like pattern, or there is a defect in the glomerular basement membrane. So hope you remember, Alport syndrome is it affects three organs mainly: kidney, the cochlea. So that's why patient will have sensory neural hearing loss. In the eye, it affects the anterior part of the lens. The pathognomonic feature would be your anterior lenticonus. There's a bulging of the lens in the anterior aspect here, and also they'll have perimacular flex. Like that will be just additional finding in Alport syndrome. So remember, when I tell Alport syndrome, here collagen, that's a mnemonic, okay? Patient will have hearing loss, he'll have an eye defect, he'll have an abnormal kidney. So the main finding would be like how to confirm is you take a renal biopsy and you see the glomerular membrane morphology, okay? Thank you.